Dr. Zweli Mkhize is today visiting the Amajuba District in the Northern Kwazulu-Natal, and we do have our reporter Karinda Jagmohan who's there and joins us today. So Karinda, day 2 of the minister's visit, what was in store for him today?
Yes, good day to you. Well, I'm here in the Madadeni Provincial Hospital. This is one of the hospitals that renovations are being done, and we're just going to show you parts of this hospital. Now, as we just take you through, this used to be an accommodation for staff workers, for healthcare workers. And you can see just beds set up here. Now, this is one of the areas that is being renovated, and this comes as KZN is still reaching its peak, as the health minister said in his briefing yesterday. Now, here in the Amajuba District, which is home to the city of Newcastle, there is cause for concern with regards to how the number of coronavirus cases are rising rapidly. To give you a picture, KZN as a whole has recorded just over 90,000 cases. The Amajuba District has recorded just over 5,000 cases, but cases rising rapidly here because 7 days ago the province was sitting at 2,000 cases. So healthcare is extremely an important issue at this moment. Today the minister visited 2 hospitals, the Niemeyer Hospital in Utrecht, which is just about 30 minutes away from Newcastle, and this Madadeni Provincial Hospital, both extremely important facilities because this is largely a rural area. So these 2 facilities is the few facilities that residents in this area can come to for treatment. Now, we do understand there are just over 500 beds in this district that patients can come to, but what the provincial health MEC Nomagugu Similane Zulu has said is that we've not yet reached our capacity in terms of occupation of beds. And so speaking to us today, the minister had urged those who are experiencing flu-like symptoms to come to hospitals for treatment. He says because often people are waiting for just about 2 days to really assess their symptoms, but by the 3rd day their symptoms have worsened and they're in need of much more medical treatment. So he says, especially to those who are elder, once they are experiencing flu-like symptoms, to come to hospitals to get treated and if need be get tested. Now, as he speaks about this, he's also discussing the preparedness of healthcare. Like I said, these hospitals in the rural parts of KZN are receiving renovations or refurbishments, not just as we reach the peak, but far beyond that, he says, because as we open up our economy, which is important for business survival and survival of the country's economy as a whole, healthcare must be stabilized. So this is what the minister has discussed, and later on he will meet with the provincial command council to discuss budgetary issues as well today.
Well, thank you so much, Karinda Jagmohan, there on the trail of the Minister of Health, Dr. Zweli Mkhize, as he goes through various hospitals in KZN assessing their preparedness for COVID-19.